Now, Nigeria's Minister of Labour and Employment, Dr. Chris Ngige, once said that Nigeria has enough doctors and whoever really wished to leave the country for proverbial greener pastures should by all means please himself or herself. However, the minister's position on this matter has by several indicators proved to be extremely incorrect. For instance, while the United Nations benchmark for doctor-to-patient ratio recommends 1 doctor to 400 patients on average, Nigeria's numbers read like a dirge, with 1 doctor responsible for a minimum of 3,600 patients. Now, with the arrival of coronavirus, one would expect that doctors who have thus far braved the harsh economic circumstances to sustain their practice here would remain behind to help out. But recent findings suggest that the opposite is the case, with thousands of doctors and other medical personnel on the front line lining up to leave the shores of Nigeria for better opportunities in countries like the United States and also Saudi Arabia. Now, for a closer look at this examination and obviously, of course, a lot more, we're being joined now by Dr. Francis Faduyile, President of the Nigerian Medical Association. He's going to be here to look at this from the viewpoints of what needs to be done to prevent the increasing hemorrhage of medical personnel from the country. What also needs to be done about the welfare of doctors and nurses. Do they enjoy adequate institutional support for the practice of their craft? These and more we'll be touching on in a moment. Welcome to the program, sir. Thank you for joining us.
Thank you very much. It's my pleasure to be here.
Good morning, Dr. Faduyile. Good to have you join us on the morning show. Well, as you may well be aware, I've been very critical of some of the statements made by the Nigerian Medical Association recently on this program. And I've also had cause to criticize the Nigerian Medical Association. Dr. Henry Ewunono was on this program. He tried to defend the NMA on some of the issues. Now that you're here, that's excellent. You have the opportunity of the right of reply, as you put it in journalism. Now, first, before we go to the other issues that Leila outlined, now the NMA recently opposed the idea of bringing Chinese doctors to Nigeria to assist to set up infrastructure. It looked like there was a communication problem between the Federal Ministry of Health and the NMA. But the NMA, which you lead, was so vociferous and so agitated and was quoting the Nigerian and Medical Dental Council Act. Now, would you like to clear the air on that and restate your position? And if you have revised your position, then please tell us.
Well, thank you very much. I'm very happy to be here because I heard about the program that you had a different view with the Nigerian Medical Association. It is important for us to know that the Nigerian Medical Association is not opposed to collaborating with other medical associations. We are not opposed to share experience with other medical associations or other experienced practitioners anywhere in the world. What we were opposed to was that this group of people, when they were coming, they do not have clear, identified reason for coming. The ECC came up to give us some medical consumables, which we appreciated. We appreciated them because they are not under any compulsion. However, they stated that while they are coming, they will come with some of their medical experts. And the information given were dispersed. They were not coherent. First one they gave was that they were bringing those people to come and set up some of the equipment they are bringing in. But the only set of equipment that are being brought in are ventilators. Ventilators do not need special fittings. Ventilators are things that Nigerian anesthetists are very used to. And even if you have to direct us, since the use of some of these ventilators, we have different ways of interacting. The world had decided, including Nigeria, to close all its borders because of this pandemic and as a way of containing this infection. And Nigeria has also done the same thing. But in this wise, we found it very difficult for us to understand why they will have to be physically present. Again, they said they want to share experience. Sharing of experience does not need your physical presence. We can do it over Skype and over all the different IT platforms. Thirdly, when they came here, the MD of CCECC said they want to, those group of people want to come and treat their citizens. And this is against any professional rule that you take professionals from one part of the world to come to another country and start treating, even without passing through the necessary regulation and control. But importantly, I want to challenge us. Do we know the qualifications of those people who are coming? If they are technicians, let us know. If they are scientists, let us know. If they are clinicians, let them know. Let us know. If they are bringing intensivists, pulmonologists, respiratory doctors, and all those are not technicians. They cannot come here to come and practice their trade. If it is experience, yes, we are ready for us to share experience, which we have been doing. And sharing experience does not mean you have to be physically present. And these are the reasons why we said, look, what are they coming to do here physically? And I think we still stand on that. If they had come here and for the last 2 weeks, they are under quarantine, of what benefit it is. I learned that they are having some discussion with some of our the leadership of the Ministry of Health via the IT platform. The same way they are doing it in Nigeria, they could do it also from China. So unless we want to convince Nigeria, the reason why they have to be physically present, if they want to build, as they have told us, they want to build some places like the one in Onikon Stadium, we have the expertise. People built those ones and they are functional. So you have to convince everybody why they are here. And that is the stand of Nigerian Medical Association.
Dr. Faduyile, thank you very much for your clarification on this and exactly where you stand. As a matter of fact, while I was also critical of the Nigerian Medical Association's stance last week, I actually had to take a review myself over the weekend, look at the situation again, and quite frankly agree with you that there are too many gaps being left out here and too many unanswered questions. But let's speak about the situation on here in Nigeria on ground now, Doctor. We have a deficit when it comes to critical care doctors in Nigeria. So first of all, I would like if you could clarify exactly how many critical care doctors we have in Nigeria. Now, this poses a risk because the more cases of coronavirus that we have and the more critical care patients that we have, we are also at a risk of therefore seeing higher mortality rates. Are we doing anything about trying to bring more critical care doctors into the country?
Well, I would like to get your definition of critical care doctor so that we are not going to be talking on different levels. What do you mean by critical care doctor? Do you mean doctors?
Sorry, do go on, doctor.
Yeah, do you mean doctors who can take care of emergency situation, or you need doctors who can take care of COVID-19 situation?
Doctors that are trained to take care of emergency situations. In this particular case, of course, COVID-19, doctors that can operate in ICU, critical care doctors.
Okay, thank you very much. First, we need to understand that for the critical care doctors, we are very, we have very, generally doctors are not enough for the population of Nigeria. And the same way the critical care doctors are not enough. Those who can operate in the intensive care unit are majorly the anesthetists. All over the country, we have about 300 of them. And I can tell you all the 300 of anesthetists that we have are dispersed all over the country. So it is very difficult for us to have a large number of them in one particular region or the other. But being that as it may, it is important for us to know that as the situation is, how many of our doctors have been encouraged or have been supported to be able to stand up to help in the treatment of COVID-19 in Nigeria? We need to understand that this is about the 6th or 7th week in which COVID-19 came to Nigeria, up to today, there are still a lot of things that the government is still playing around with. For example, we have discussed about medical insurance for those who are treating COVID-19 up to date. Up to date, there had not been any obvious paper that the government has come out with. We are talking, a lot of people have talked about the hazard allowance and other incentives. Up to date, a categorical statement that is cast in stone is not yet out. These are things that we had expected the government to have quickly worked around so that people who are working will know what they are going to, what they are facing. Remember, we have Lassa fever in this country that is indigenous with us. And Lassa fever had killed in the last 3 months over 135 medical and health workers. And up to today, there had not been any major step in which the government has put in place. So what we are saying is that even while we are looking at critical care doctors, which are very important in this respect, we must also look at the general outlook of what the government is planning for the health workforce, so that the health workforce will be highly motivated to face this pandemic that has come to Nigeria. And Nigeria health sector had been very weak over the years because the government had refused to put money into it. It has been chronically underfunded. And now, if we have this, even when the developed countries where they have strong health systems had been overwhelmed by the infection, we pray we don't get to that level in which we would need a lot of these critical care doctors, who we have to take care of a lot of Nigerians, who we need this highly skilled treatment. We need to do a lot in our ability or in our quest to stop this community transmission. We need to do a lot for us to get early diagnosis, quick treatment, mass treatment for our people. Take people who are positive from circulation, isolate them. Make sure we do not have a large number of Nigerians who are infected with COVID-19. Shortly, in just few days, Kano State had the first COVID-19 positive in the state. Today, they are going close to the total number that we have in Abuja, FCT Abuja. And these are the same signs that we are trying to contain. We need everyone, we need the government to show leadership, to show commitment towards the health sector. It's not about talking every day. It's not about saying this is what is happening. It's about putting plan in action. We have reason to call on the eggheads. Unfortunately, we have an issue in the country today. All universities lecturers are not being paid because there is an impasse between ASU and the federal government. For 3 months, they have not been paid. Our professors, our leaders in medical profession are both lecturers and consultants in the teaching hospital. They have not been paid for up to 3 months. We want to appeal to the federal government. While you are doing palliative for downtrodden, you must be able to allow those who will think for us, those who will now work on the vaccine, those who will now give us the direction, scientific-based direction, to be properly taken care of. They have not been taken care of because they have not been paid. We call on the government to rescind that decision for now. At least let us resolve the issues that we are facing today. And let us be able to contain it now. Because if it explodes, which we seriously pray against, and it may be inevitable if we continue the same trajectory that we are going. If we can do that at this stage, that is the best for us, because it might be very, very difficult for us to be able to take care of Nigerians if we have a large-scale explosion of COVID-19 in this country.
Well, Dr. Faduyile, I mean, very excellent recommendations there. I'm sure that not many people will disagree with you. But just by way of clarification, what you said about doing a lot for the frontline health workers who are engaged in COVID-19. You will recall that the Minister of Health, Ozage Hanire, had cause to come out to say that the federal government is already working with a particular insurance company, which he did not name, that will provide life insurance for frontline health workers that are at risk. And some states of the Federation have announced publicly hazard allowances for frontline health workers involved in the war against COVID-19. You may say that what they have done is not enough and they should do a lot more. And nobody will agree with you on that score. But to say that they have not said anything about that or not done anything about that may not be factually correct. But I would like to ask you two quick questions. We've been having lockdown.
Well, maybe I can.
Hello?
Maybe I can quickly answer this.
Okay. Before I ask my questions.
Number one, it is not true that any health worker in this country has been given any form of insurance. You can quote me, and we can go and do a research on that. There have been some insurance companies that had offered to give insurance to health workers. They have not been insured at all. And if they are insuring health workers and you are having consultants, specialists, very specialized nurses and other health workers, and the insurance they are given is 1 million or 2 million life insurance, you should know that that is grossly under insurance, that is grossly low for high class or high caliber specialists of that regard. Let them come out with what they have and let us know who they have insured. And the other one you are talking about, hazard allowance, nobody has discussed about hazard allowance. What FCT said was that they were going to give 50,000 per day or 30,000 per day for doctors, nurses, and other health workers. And they have not given anybody as such today. So I think it's good for us to know that there is a difference between what is said on the mass media and what is on the reality. Why we are not coming out to start shouting about money? Because we have a pandemic in our hands and we must take care of Nigeria. But we should not be taking for granted that things that are needed for health workers at this stage are not provided. We don't have PPEs. I can tell you, leadership of Nigerian Medical Association in different branches are infected with COVID-19. We have a state chairman that has been infected as of today. We have a president of an association in one of these, the big teaching hospital that is infected. They did not get infected while they are sitting at their home. They got infected by treating Nigerians. And up to today, 6 weeks, we are still talking of papers, we are still talking of mass media, and nothing is done. This is what we call a lot of activity, no movement. So we must be able to verify our facts. Things on the television, things on the newspaper does not necessarily mean that it is being done. And I stand to be corrected, sir. It is not correct.
Okay, thank you very much, Dr. Faduyile, for that clarification. But now, the question that I really wanted to ask, for how much longer do you think that Nigeria should be on lockdown, given the statistics, given the seroprevalence that we have seen, given the trend that we're witnessing in terms of the numbers of confirmed cases and critical cases, either severe or mild or, moderate. Now, beyond that, the big controversy in town is over the use of face masks. Some state governments are insisting that face masks, once you use face masks, you don't need social distancing. Do you think that face masks constitute on their own a solution to the COVID-19 menace?
Well, thank you very much. I must first of all say that face masks, we have different grades of face masks. The one that gives 95% of protection of COVID-19 is the N95, and that one is advised to be used by those people treating at the isolation or the treatment. We have the normal surgical face mask that gives a protection of about 15%, or 30%, sorry, about 30%. And we have paper or other type of face masks like the cloth face mask that its protection is about 10 to 15%. So we must be able to understand that while we are putting on face masks, it does not take the absolute risk away. People must still observe every other guidance and direction that is given. It has been observed scientifically, generally over the world, that the physical distancing is the most important step that can contain this the transmission. So, apart from either you use face masks or you don't use face masks, physical distancing is the most important. So, anybody who is giving us this view, I think the person this is not a political issue. It is not a political issue. It's not an issue that you just sleep and wake up. And even scientists does not use one experience to come out with generalization. They have to do it over time, and they have to confirm what they have done. So I can tell you, face mask, as good as it may be, does not confer 100% protection. Even the paper, the cloth face mask is just about 20-30%. It is when we don't have any other thing to do that we say, let's use it. As it is, if you want to ask me, we must be able to train people on how to use face masks properly, how to discard it properly. Because today you see face masks on the floor, you see people touching face masks back and forth and touching themselves. And if you don't use it as you ought to use it, sincerely, it will be a source of infection to that person. So we need to do those two things. Number 3, coming out to see the results that are coming out in recent days. This is just showing the true prevalence or the incidence, I should say, of COVID-19 within our community. Before, we have not been doing mass screening. We have been doing screening that the total number that we screened up to late last week was 5,000 and some over 5,000. We need to do mass screening to know the true incidence of COVID-19 within this country. And that is what we are seeing. And I can tell you, if we miss it at this time, that we cannot quickly get all those that are infected within the community, get them isolated, and we allow an unfettered transmission within the community, we are going to stay for a long time for us to be able to contain it. For the lockdown, I think the government needs to find a way to alleviate the pains and the difficulties Nigerians are facing. It is good. That is the best thing, that we lock down everywhere. And that is what Nigerian Medical Association had advocated and still believe is the best. But you cannot lock down when you do not have other issues in place. And the other issues in place is get food for people so that we can ensure that we stop this virus. If we do not get this COVID-19 contained as early as possible, I have been in Kano for 2 or 3 times. And if you see the massive population, you will be afraid if we have full community transmission in Kano. Same thing is happening in Lagos. And I pray that we don't get to that position. The federal government needs to redouble its activity to see that this palliative gets run so that people can stay indoors, so that people can observe all the recommendations given. And it is until we do that that we'll get the best that we needed.
Dr. Faduyile, thank you very much for this viewpoint. Now, as we bring this conversation to a close, I'd also like to get your opinion on public-private partnerships when it comes to COVID-19. Now, on 2 occasions last week, we had headlines in the news about the federal government's warning against the treatment of patients at private hospitals. We also heard that the Nigerian Medical Association, Lagos chapter, I believe it was through the president or the chairman and the secretary of your association, Dr. Saliu Osheni, and also Dr. Ramon Moronkola, had come out to also state that the NMA is against the treatment of patients of COVID-19 at private hospitals. Now, we have also learned over the past few days that there are clearly existing partnerships between certain private hospitals and the government on different levels. For example, First Cardiologist Consultants, where the late Chief of Staff, Abba Kyari, was treated. or rather not treated because he passed away. So I want to get your opinion going forward. Do you think, or do you completely reject the treatment of patients of COVID-19 at private hospitals? Or do you think what we need is better collaboration between the public health agencies and private healthcare medical professionals when it comes to the treatments of COVID-19 patients, especially as cases rise?
Thank you very much. I think this is an area that we need to clarify very well. I want to make bold to say that there is no public institution in this country that is treating COVID-19. Public. The areas that we have the public institution treating COVID-19 are specialized areas that they have done some engineering control system, administrative control system, and what have you, for them to be able to effectively treat COVID-19. So, if we are looking at public-private, you don't treat COVID-19 in any of the general hospital or any of the federal medical center or any of the teaching hospitals. You must provide specialized area to have that. And it is on this basis that we know that COVID-19 is highly contagious. It is not just the expertise of those who are going to treat that is needed. You need to put a lot of stringent control for you to be able to effectively treat. One, the nurses needed to be treated, to be trained. The lab attendants need to be trained. The cleaners need to be trained. There must be a special way of disposal of things that are used in those places. These are things that must be in place before you can satisfy any of the private or public place to be able to treat COVID-19. And as it is, the stand is we do not feel that as it is, as the containment method, for us to have private institutions treating COVID-19. And what has come to fall is because we have a highly placed officer of the Federal Republic now coming out to, unfortunately, we commiserate with the family who died in a private facility. And everybody, including Lagos State government, had consistently stated that they have not accredited any private institution for the treatment of COVID. It was aftermath of this death that they now came out and they said they have done that. I think this is putting health system on two different levels. Well, it is understandable, Nigerian, because we have those of us who are just ordinary citizens who go to one health system, and those who are bigger citizens or higher class, you cannot use the same health institutions that they are superintending. And it's really unfortunate. If we make every effort to make our health system very, very good enough, anybody can go there. When the Prime Minister of UK was sick, he went to NHS. He didn't go to the specialized place, and everybody knew where he was. So I think that is what we should be aiming at. And for Nigerians, I think it's good for us to let the government know, and we should all come together to say this. This is an opportunity for us to improve our health system.
Well, thank you very much, Dr. Faduyile. A great opportunity for us to improve our health system. Excellent point there. Thank you very much for joining us on The Morning Show.